Are you having problems with your poop? Here are 5 tips to combat constipation while on semaglutide. I'm here with a really good friend of mine, Dr. Elias. She's the Director of Colorectal Surgery at Kern Medical, and I brought in my expert witness to discuss how to handle side effects of semaglutide, which are most commonly constipation.
Thank you for having me.
Yes, my pleasure. So what do we tell patients to do when they're experiencing this?
So number 1 is fiber. The average American only gets about 10 to 15 grams of fiber in their diet, which is less than half of what you need. You want to try to get 25 to 30 grams. If you can't do it with diet alone, things like fruits and vegetables, then you're going to want to use a supplement such as Metamucil. Now, the most common complaint I get from Metamucil is it makes people feel bloated. Not everyone, but some. In that case, there's a brand called Consul, which is great for sensitive stomachs.
Perfect. Okay. And we talked about this, but gummies versus powder. Gummies seem easier to get, but...
But unfortunately, most gummies have less than a gram of fiber per gummy, so you're really not getting that much. Now, there is an exception. Consul does make a 1.5 gram fiber gummy, and so that one is great. In general, mix the powder and shoot it down as quickly as you can so it doesn't turn into a gross gel.
I like that. What else do we need to do?
Number 2 is water. So your fiber is not going to be effective unless you have enough water to go with it. You need at least 2 liters or about a half gallon of water a day to be enough hydration. And you actually need more than that if you're excessively sweating.
Yes, and we've talked about this with our patients on semaglutide. They should be exercising, therefore the excessive sweating is a concern. Also, we're on a weight loss program. Of course we should be talking about water intake, and I do with all of my patients, but it's going to help in multiple areas, not just the constipation.
And you bring up an excellent point. My number 3 tip is actually movement. So movement helps you to get your gut moving as well. And so by moving more, you're going to have better poop.
Yeah, again, back to the weight loss and exercise. So they all kind of are going to go hand in hand and aid in our results that we're looking for, plus managing side effects. What's number 4?
Number 4 would be investing in a squatty potty, or even if you have a stack of books around the house. When I travel, I use the hotel trash can from the bathroom and I turn it upside down so that you're in a squatting position when you poop, because that helps your muscles work better.
Yes, and this goes back to like back in the day, they didn't have modern potties that we sit on, so we know from how many years of evidence that the squatting position is really the best position to be in. And number 5?
Number 5 is that you don't want to strain, please. So straining can actually lead to additional problems, things like hemorrhoids, prolapse. If you can't go in 5 minutes, get up, walk around, and come back to the toilet.
Okay, so those are the 5 tips to manage it. Now, if it's still occurring, then what?
So if it's still occurring, then Miralax is a safe drug to use. I don't want this to be your fallback. Fiber and water are your standards, but Miralax is safe. You can take a capful every hour until you have a bowel movement. If you find that this works for you, then you can do it once a day. But if you're needing to use Miralax on a regular basis, you should be evaluated by your doctor to make sure nothing else is going on.
Okay, and is there anything else that we should let our viewers know that's really important?
If you're having blood in your stool, that is another reason to go see a doctor.
Okay, and I will include your contact information below. She's a fabulous colorectal surgeon. She's been a blessing to have in our community, and unless there's anything else we should mention, I think we've covered our bases. So if you have any questions that go outside of my scope and, aesthetics and weight loss, then I suggest making an appointment with your colorectal doctor. If you're interested in starting semaglutide or tirzepatide for weight loss, come see me. I will help manage the symptoms, and I have really good resources to get me through any questions that I'm not comfortable answering.